Hey, this is Brad Block, host of The Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle. Welcome back to the podcast. On today's episode, super special guest. I know I say that every time, but I really mean it this time. We've got Kristin Flanary, otherwise known as Lady Glockenflecken. She's a podcaster, speaker, writer, and advocate on the topics of trauma, resilience, and co-survivorship after saving her husband from sudden cardiac arrest. She and her husband co-host the medical comedy podcast, Knock High, with the Glockenfleckens, and are touring currently Wife and Death, a live stage show based on their life story. We have something in common. She went to undergrad at Texas Tech, where I actually spent a summer at science camp in high school. Super cool. She also has a master's in experimental psychology, which has helped her navigate and become a champion for the recognition and support of caregivers and co-survivors in medical care. So welcome to the podcast.
Thank you. Thanks for having me. I didn't know that Lubbock connection, so that's fun.
Lubbock, Texas. I remember you could smell the feedlots. That's what I remember.
Did you grow up around there? Is that how you ended up at science camp there?
It was like a research opportunity. You would spend the summer in high school writing a research paper on plant molecular biology, Arabidopsis thaliana.
Was this an HHMI thing?
HHMI. I'm not familiar with that.
Howard Hughes Medical Institute. There were a few programs that Tech had that kind of sound like that.
It was like some type of a specific scholar that helped you eventually enter the Westinghouse competition, which was Westinghouse, and I think it became something else, and then something else. Yep, that was me. That was me in high school.
All right, I can't judge. I would not be one to speak.
And then I'm sure a lot of the physician audience, they're like, yep, that was me, because my parents put all this pressure on me to get into the right college so I can get the right med school and do the right, and then here we are.
Lots of overachievers in this crowd.
So you and your husband have been very public with his health history. Just to go over it quickly, testicular cancer in medical school, and then another distinct testicular cancer in residency. And then after residency, cardiac arrest in the middle of the night in May of 2020, right as COVID was raging. Now, clearly his doctors knew the medicine because he's doing well, and we all benefit from him now because of his amazing skits and the amazing content you guys create out there. But the reason you're on the show and your advocacy is because there are some blind spots that we have for family members.
Yes.
Right? And let's start with, where did you learn about being a co-patient and a co-survivor?
So I had been one for over a decade before I ever came across the term. And I learned about it from a research paper from Katie Dainty and Kirsty Haywood called The Forgotten Patient. And it described people like me. At that point, that was after the cardiac arrest. So I had already been through the 2 cancers and then the cardiac arrest and giving CPR. And I found that paper, and that was the first time I had ever seen anything talk about the person that is attached to the patient in any way other than calling them a caregiver, which, yes, I was, but that is a distinct role from co-patient or co-survivor. A lot of people can be a caregiver with various connections to the patient, and often a co-survivor is also a caregiver and vice versa, but not always. And that paper described it as there's really another patient in the room. If somebody is in a hospital room with a patient, you don't just do that for just anyone, right? If someone's in that room, that means their lives are intimately connected, and that person's life is also probably being affected by this patient's illness in a very profound way. And that was certainly the case for me with both cancers. They didn't happen in my body, but they very much happened to me too, just in a different way than they happened to my husband.
Rather than me assuming I understand how it affects you, can you describe yourself? Because I was about to mansplain. Could you teach us how those things affected you?
Yes. The first cancer, and I have to say, people always want to make it like an either or, a me versus him, family member versus patient. It's not that at all. It can be both. It's both and.
No, you're comedians, like improv. Yes, and.
Yes, and. That's right. He has his own experience as a patient and as a survivor. And my experience as a co-patient and a co-survivor does not negate his experience, but nor does his experience negate mine. We both have our own experiences individually and together with these medical events that have happened. With the cancer, that was in our mid to late 20s. We had a 11-month-old daughter. I had just graduated from grad school and he was still in medical school. We were still very much in this really precarious place in life, really depending on student loans and just whatever. We were far away from family and none of our friends had children at that stage. And we were trying to juggle and balance all these things. And so that in and of itself was difficult to throw a medical event and a word like cancer on top of that. But it also was more of a psychological thing because testicular cancer, obviously, when it's caught early, it's very treatable, and his was, and we both knew that. But it's still the word cancer, and it still does a number on your mind and your emotions. And, when you're that age, mid to late 20s, it's like, I think we were 27, you still feel a little bit invincible. You still feel like your whole life is ahead of you. And we had just started our family, just gotten married, just had a baby, not even had our first jobs yet, or at least professional jobs. And everything was just starting. And so to hear a word like cancer, that really throws you for a loop. And it really takes that sense of safety and invincibility away from you prematurely. And that has an effect. And even though I knew it was treatable, there's always the what ifs that happen that you think about.
Because, it's still cancer and it's
still
treatable,
cancer.
but that doesn't mean that everyone has the same outcome.
I remember thinking they talk about 5-year outcomes. At 27 years old, I want to know a hell of a lot longer than 5 years from now. So yes, there's still a lot of uncertainty and a lot of questions and a lot of kind of mental grappling that you have to do with that word. And that was the first one. He had surgery. That's all he needed to treat it. He didn't need chemo or radiation. So we were really thankful for that. And then in residency, we had another baby. She was 1 year old. And he got another primary cancer in the other testicle. So it's extremely rare to have two separate primary cancers, bilateral testicular cancer. And so then he had to have another orchiectomy. And so then there we are again, 30 years old this time, still thinking the same, okay, now I have 2 kids. Am I going to have to raise these 2 kids alone? Because this guy sure seems to like to grow cancer.
Yeah.
What's happening here? Now there's almost beginnings of a pattern. Is that going to continue to be a problem? I guess we're done having children biologically because there's no more testicles involved. We had to deal with that. He banked sperm so that we could feel at least a semblance of control over the decision. But really, it was difficult. You lose a lot of control over certain aspects, fertility being the main one. But also, he can no longer make any endogenous testosterone. So he has to rely on total replacement therapy. And I think you and all of your listeners can probably imagine how much insurance likes to deal with that.
They need to prove it every quarter, right?
Yes.
That
it's
he
like,
still
how
needs
many
it.
times do we have to, you don't just
you
regrow
not
a testicle.
understand? Yeah.
Who is on these committees that's making these decisions? So yes, that is
I'm sure
an
he has a skit
ongoing
on
battle.
that.
So many insurance skits. They were all born out of frustration from our real life events. And yes, that is definitely one of them. It's a recurring nightmare that we've had to deal with for almost 10 years now and will have to deal with for the rest of his life.
I like to talk about communication a lot on the show and how we could communicate better with our patients. And you had mentioned that this particular cancer is very survivable. People tend to do very well. And here's your 5-year survival, right? Do you think there's a way that we could communicate that differently so that it is a little easier on the ears, like realistic, right? You don't want to take away from the gravity of the diagnosis. How do you find that
because
that
it can
right
feel
way of talking about it?
dismissive, right? Doctors, there is this attitude with testicular cancer that I definitely picked up on of, it's one of the good cancers. We heard that a lot. I get that, logically, I understand, and I do see the good intention behind that. But when you're the one sitting there, there's no such thing as a good cancer. And it is comforting to know that it is very treatable. I think, though, the communication, it comes down to just be a human. Remember that they are humans and you are humans, and just have a normal human interaction, right? Forget that you're in the hospital. Forget that you're wearing the white coat. Forget that you see this all the time. Try to imagine If this was your, friend, family member, child, what have you, how would you talk to them about it? And try to like tap into that, right? Just to feel
Yeah.
seen and understood goes so far in making a big difference. I think everything that I experienced with the healthcare system as a patient and as a survivor that ended up doing more harm to me all boils down to that. I'm not a textbook. I'm not a case. I'm a person.
Yeah.
And there are emotions attached and there are people attached. And all you have to do is remember that you're a person instead of, I don't know. I
Yeah. The
get that
next
you need to
patient.
be a
I mean,
professional and you need to have your own emotional boundaries, but it's just to have a normal human interaction and have a little bit of compassion for the person.
yeah. I think one strategy that I got from Gita Pensa, who you've had
Yeah.
on your show, where she says in the emergency department, sometimes you'll have someone with a thought disorder or you'll have someone with a substance use disorder and they've got it pretty rough. And you might be the only person that's been nice to them all day. And it makes me think of this one interaction that I had with a patient who had a thought disorder. He didn't have a place to live at the time. I had, I think, 2 little kids at the time. Now I've got 3. And all I thought was at some point, he was someone's little boy,
Yes.
someone's apple-cheeked,
Yeah.
cute little boy that they wanted to do nothing but protect and kiss and
Right.
love. And now he's in this awful position where it just needs some humanity. And
Yeah.
when I have trouble because it's my 29th patient of the day
Right.
and they might be perseverating, this is not oncology, right? It's a little different. It's like throat clearing
Sure.
or something like
Right.
that. I have to put myself in that. Remember, this was once someone's little baby. Please treat them like their parent were in the room right now watching that. Like they're
Yeah.
having a tough time and
Right.
you're having a tough time, but try and remember this.
And there were so many experiences that led up to them showing up in your office or in your clinic, right?
Yeah.
Like there's a lot that has happened before they even get to you. And you may not know the details or have seen that, but I think you can assume in this line of work, it's been a rough day for that person.
Yeah. Let's go through with, we're not throwing anyone under the bus because he's clearly had excellent outcomes. He's doing really
Yes.
well, giving back to the community, making all of our days better. But there's a lot to be learned from your experiences. So let's deal with it in chronological order. Starting off with your experiences with testicular cancer, is there
Mhm.
anything, if you had some of the physicians or other healthcare professionals in front of you right now, that you would want them to know that would have made your experience a little more human?
I would start with, look at me, acknowledge that
Yeah.
I'm in the room. Ask me if I have questions. Both times with the cancer, I was a fly on the wall as far as they were concerned. Here's the patient and they talk to the patient, and as they should, but just don't forget that there's a second person in the room and they're not there as an accessory. They are very much having this happen to them too.
Especially when you're talking to men. Because
Yes.
the significant other is inevitably going to remember more about what had happened during that experience.
And then if the significant other is not there, I'm jumping ahead a bit because I wasn't able to be there for the cardiac arrest. If they're not there, speaking of men, like at least mine and probably many others, I get the dude version of the story. And so I'll tell him, will you please give me the girl version? Give me the details. So
They said
yeah,
it was
like,
fine. That's
Exactly.
not what we said. Yeah.
But for those cancers, I may as well have not really even been in the room. So it's
Wow.
really just such a low bar. That's the good news, is that to improve this issue, it's so easy because all you have to do is acknowledge that there's a person there and then be a person to them. That's it. That'd be
Wow.
100% improvement.
Especially considered what happened to you in the hospital while he was in the ICU. So now we're
Yes.
going to the cardiac arrest. You resuscitated him. Paramedics came, took him to the hospital, got him to the ICU. I'll fast forward ahead. They kicked you out of the hospital,
Yeah.
right? There's a story there. Can you tell us that story?
I always have to caveat this with I understand where they were coming from and I don't begrudge anyone anything. I love healthcare workers and I am married to a healthcare worker. I've been along since college, so I've seen the training. I've seen how much all of you care about people and about your jobs. I understand that there's no malicious intent, and I don't want to come across as though I am blaming anyone or accusing anyone of anything. I just think it's a systemic issue that we can all do better once we are aware of where the gaps are. When I went to the hospital, again, this was May of 2020, so everything was up in the air and we weren't sure what was happening with COVID. There were all these protocols, but Everyone was still figuring out what the protocols were. There was a lot of uncertainty and confusion and fear. And of course, they didn't know if COVID had caused his cardiac arrest, or even if it hadn't, did we have COVID? And at that point, that was a very scary prospect. And so when I got to the hospital, they told me that I wasn't allowed in, of course, per the protocol. But I had a conversation with the paramedics beforehand, and they'd given me a little slip of paper that was supposed to be my hall pass to get into the hospital. And so when I got there and they refused me at the door, I said, I have this note from the paramedics, and they said I would be allowed in. And they said, okay, we'll go ask whoever the supervisor was. And so they walked away for a little bit. And in that time, I saw a paper on the door that had 3 things listed for 3 reasons that you would be allowed in. And one of them was if you were the partner of a person birthing a child. I can't remember what the second one was, but it didn't apply to me either. And then the third one just said end of life case. And of the 3, that was the only one that could have at all applied. But I'm not in medicine. I don't know the statistics. I didn't even know at that point, really, that he had a cardiac arrest. I didn't know at that point the difference between a heart attack and a cardiac.
Wow.
I knew it was bad.
So that's when
I
the
knew,
gravity of the situation really hit you.
So I had done what I had done, but I was like in shock. And I had seen him turn gray and they'd shocked him and everything.
He just
but
time to process.
Exactly. And so that when it really hit me, oh, I'm allowed in because they think he's going to die. So that was already upsetting. And then I did get to go in, and the woman at the desk handed me, shook my insurance, and then she gave me a blank advance directive. And I was like, what am I supposed to do with this?
Oh, not the time, right? You just got there. Holy cow.
But I took it, and then they weren't real sure where to put me because normally you just go into the waiting room, I guess. But with COVID, everything was all weird. And so they put me into kind of an intermediary waiting area. Maybe there's a term for this if you're a professional, but I don't know. It was a purgatory. It was a waiting area in the radiology department where the patients would put on a gown and then come to this room to wait for someone to come take them back for their scan. So it wasn't like the main waiting room, but it was an intermediate waiting area. The thing is, though, because it was in radiology, all the walls in that part of the hospital were lined with lead, and that cut off my cell phone signal. And no one thought about that.
As if you didn't feel alone enough in that situation.
Exactly. And I am having to be the point person for all of our family members and close friends who knew what was going on, were very concerned and had questions. And so I have this job to do in addition to just being emotionally distraught. And then they cut me off from all of the outside world, and no one was allowed to come in with me. So I was all alone.
And it's May of 2020. So it's not like you can go skating around to a place with better reception and come right back, because who knows, then they'll revoke your privileges.
Like, I'm not one to just sit around and wait when there's a problem. Take action. So I would walk down the hallway where I could still see that room, and I was just 20 yards or something away from that room. I could still see the door to see if anybody had come in to give me an update, but I had better signal there. So I would go and I would make my phone calls or text messages, check my voicemails, just see if there were things that I needed to attend to. And then I would go right back in the room. So I'd only go, I wasn't like hanging out down there. I would just go back and forth. And I had a mask on and all of that, but we didn't know at that point if masks were actually effective. So people kept walking by and giving me funny looks. And 1 or 2 people offered me a chair, which I thought was funny. I was like in the hallway. They wanted to know if I wanted a chair. So they're like trying to be nice, but they were also like really looking at me like, what are you doing? You're not supposed to be here. And so then eventually the same receptionist that had let me in at first came and said that I had to leave because I was making people nervous. So it's poor choice of words. But again, I get it. We didn't know. Like, you have to remember what the situation was in May of 2020. Everyone was terrified.
Yeah.
And we knew little to nothing about COVID at that point.
It could have been, excuse me, can I help you with something? What's going on here? What are you doing here? So be a human.
You don't have to jump straight to kicking me out. I was doing my best to do what you had asked me to do. And no one had explicitly said I couldn't walk down the hall either. It's not like I was breaking a rule someone had given me. But yeah, it was insult to injury, right? And so then I couldn't even be in the building with him. After that, I was not allowed back into the hospital. At that point, he had been in the emergency room, but then they eventually transferred him to the ICU, and I didn't get to see him again until he came home, just on FaceTime once he woke up. So that was all difficult. Another thing, back to the communication, when I was in that waiting area, I was getting updates occasionally. At one point, I don't want to say which doctor it was because I don't want to blame anybody.
I'm not throwing anyone under the bus here. We're looking to learn.
One of them came in and gave me the statistics for out-of-hospital cardiac arrest. So at this point, my husband is still unconscious. He has a heartbeat, but he's unconscious. We don't know what has caused it. Everything is very much up in the air. And he comes in and leads with the statistics. And those are obviously very bad. 1 in 10 survive out-of-hospital cardiac arrest. And then I was asking him questions and trying to understand, wrap my head around all of that. And in that conversation, he said, I would have liked it if you had seen him collapse, because then we would know if CPR had been started immediately. So what he was trying to say is I could give you a better estimate if I knew when the cardiac arrest had started relative to when CPR had started. That was the logic flow in his mind. But yeah, the way that it was said to me was like, yeah, you did this wrong. And I'm like, I'm sorry that I was sound asleep in the middle of the night in my own bed. What was I supposed to do? Also, I think in retrospect, it stung in the moment, but then later on when I learned new things, it made me really angry because one of the things that I had been very clear about to the dispatcher, to the paramedics, to the physicians at the hospital was that what had woken me up was that he was making very loud, strange, snoring-like sounds, but they were very wrong. Again, not a medicine. Didn't know what those were, just knew something was wrong. Learned later, those were agonal respirations. And when a cardiac arrest happens, those happen at the beginning. So the fact that I heard those is a good sign that CPR was started relatively quickly.
But you should have known how long you were sleeping for before it woke you up. That's the point. Yeah, you should have known.
Yeah.
With the little time we have left, I just want to cover one more thing, and that is the fact. So with his testicular cancer, the advice is just acknowledge that there's another person in the room, look them in the eye, talk to them too. But this is different because you had a traumatic experience as well,
this
right?
One was far worse.
Yes. So you're not sitting there getting the news at the same time, but it's happening to him and it affects you as well. This is a traumatic event where you witnessed this, you were part of it. And so what would you want physicians to know about a co-survivor in this type of situation in particular? How should we be addressing and helping the co-survivor better?
Yeah. I think the first thing to recognize is, and I'll speak to cardiac arrest because that was my experience, but you could extrapolate to other things too, right? But in the case of cardiac arrest, the first thing to recognize is that doing CPR on a loved one is extremely traumatic. That's just not recognized. We have all this great, let's teach everyone to do CPR. And yes, let's do, because it can be so effective and save lives. Absolutely. And also, once we teach them to do that and ask them to do that, and then they have done that, let's make sure we don't forget to circle back and provide them with the support that they need, because that was a very psychologically traumatic thing that they just had to do.
And so is what you're saying that like kind of point them towards resources, like acknowledge that this is a traumatic, super traumatic experience for you. Some people might end up with PTSD. Many do.
Yeah.
This is what I would recommend, right? Is that like you want the physician to hit this head on, acknowledge it, give them some direction.
Exactly. And again, it comes back to just like feeling seen and understood. Really, step one, the physician doesn't need to be all things to all people, right? You are trained in a certain thing. I want you doing that thing. But you also know how the hospital works, and you can connect people with the right people for them that do other things, right? So do you have a chaplain? Do you have a social worker? Do you have a department that handles is there a psychiatrist around that you could, I don't even know because I don't work in a hospital, but whoever you have in your system that you can connect them to would be great. And please do not say, make sure you get help for yourself, because let me tell you, they cannot. They are not in a state. The executive function is not there. It is not so easy to just pick up the phone and call a psychologist and make an appointment and show up, right? That's a whole process, and it does also require a lot of like executive function and time, a waiting list, and all sorts of so many things need to happen before that.
To whom I recommend that type of thing to, who are not having issues with executive function, and
Yes.
it's a struggle. Like,
Yeah.
do they take my insurance? Who do you recommend? It's dating, because you might find
It
someone
really
you
is.
like, and you might like them for a little while, then you stop liking them. So there's a lot to
Right.
navigate here.
It is very difficult, right? Even in the best of circumstances, to find someone who's a good match for you and takes your insurance and all of those things. And in the moments when those are happening, even like weeks to months out, I was not capable of doing that at all. I wish that what had been there had been someone, whoever it might be appropriate to be, that worked in the hospital to say, hey, we have this resource, we have this person, or I am this person. If you would like, you can use this. I will help you, or you can go over here to this department and they will help you, or what have you, right? You don't have to force someone to go get help if they don't want it. But if it had just been offered to me and someone would walk me over there because I'm not in a state of mind to navigate myself around, I would have loved it. I would have taken it. It would have made such a big difference. So yeah, connecting them with resources. And I've actually been, again, this is specific to cardiac arrest, but it does have things that are relevant for other kinds of illnesses too. I've been involved in, there weren't any resources. After I was home and everything, like I was Googling for months and I was trying to find things, and it took me forever to find anything that helped. And so one of the things that has been my therapy for myself is being involved in creating those resources for people. So now they are there. Now if you search, you will find something. It's called HeartSite. It's ourheartsite.org. There is also casahearts.org. HeartSite is a more informational resource about, what just happened? And it breaks things down based on your role, whether you're a survivor, a co-survivor, bereaved, a first responder. We all have different questions and different issues after that. So it speaks to each of those roles. And then CASA is a community support, like peer support network for people that have been through cardiac arrest. And there's many other things out there for other kinds of illnesses. But with cardiac arrest, people just haven't survived until recently in history. So there's fewer resources out there compared to something like stroke or breast cancer or some of these other things. So yes, there's always that. If you don't have anything at your hospital, there's always at least that you can point people to.
And you can also find some levity by listening to Knock Knock Hi with the Glockenfleckens. Thank you so much for your time. And I just want to plug the podcast for both of the listeners that I have that might not know who you are. For everybody else, they know exactly who you are and they're already consuming all the material.
Well, thank you.
So it's Knock Hi with the Glockenfleckens is their podcast. And actually, if you could plug those two resources that you've created, amazing. One more time.
Yes, it's HeartSite, ourheartsite.org, I believe, and CASA, Cardiac Arrest Survivor Alliance, which is casahearts.org, I think. Don't quote me on that. I'll have to fact check that for you. But if you put that in, you'll find it. Google will show you.
Thank you so much for your time and all you do for physicians and for co-survivors.
Oh, thank you. Thanks for having me on.
Thanks for listening. So please share it or like it or comment on a social media post or write us a 5-star review. Thank us again for listening to The Physician's Guide to Doctoring.